Hello friends, I'm Dr. Suresh Pandey and today I'm going to show you the procedure for implantation of a toric phakic lens. We are going to implant toric phakic lens to correct myopia of minus 10.5 diopter with 2 diopter cylinder, and this is the toric phakic lens for Kegop India, and the power of the toric phakic lens is 12.5 diopter minus 12.5 diopter with cylinder of 2.5 diopter, and the diameter of the toric phakic lens is 12.5 millimeters. So this is the toric phakic lens. You can see this is how it comes to pack, and I'm going to open it from here. This is the right packing. Alright, I'm just going to open it. The first step is load the lens and to implant the lens. This is how it comes. And on it, then it comes like this. So I need to make the correct orientation of this lens. So this is the correct orientation of the lens. You can see I'm going to implant in the left eye. So these are the two holes which will stay superiorly, and you can see this is the correct orientation of the lens. So here you can see this is the two marks which are covered, two holes which are covered by the upper lid. This is the leading haptic. You can see notch here. So this is the notch here. This is notch here. So this is towards the left side, the leading haptic, and this is the trailing haptic notch, which is on right. And the other two holes here, one and one getting, and these holes are covered with the upper eyelid. This is the central hole of 380 micron size, and the other two torus marks. So this is mark. This is one mark here. So this is a smart toric design, and the advantage of this lens is that you have to position it at 0-180 degree, and this is going to be placed like this. So there is a convexity. The loading of the lens is very simple and straightforward. You can see this is loading of the lens in the cartridge. I put the viscoelastic and simple and straightforward. You can see this is long lens is loaded in the cartridge, and once you load the lens in the cartridge, then we can see while once you close the cartridge, so you can see. So once you load the lens, and then you close it. So this lens is visible. Make sure there is no haptic is caught in the cartridge ring. This is very important, otherwise this can be damage to the haptic. So this is the correct loading of the lens, and once we load the lens, this is ready to be injected. Now surgery under topical anesthesia, supplementary side port incision. This is side port incision. You have to careful to create a side port incision without avoid any trauma to the lens. This is intracameral lignocaine I am putting, and this caused little stinging. थोड़ा दर्द हुआ बेटा, जलन हुई, थोड़ी सी जलन होती है. And this is the viscoelastic. I am putting the viscoelastic in the eye. थोड़ा सा दबा लगेगा बेटा. And this is the another side port incision at 12 o'clock. This is another side port incision. And once again, you have to be careful not to cause any trauma to the lens. And this is the main incision, temporary incision here. And this lens can be implanted to 2.8 millimeter incision. So I made 2.8 millimeter incision. As you can see, the same implantation of the lens. You can see the lens is opening nicely, beautifully, and you can see this is very nice implantation of the lens. And once I implant the lens and a viscoelastic, and I will suricus here. The Lasik septic pairs which I'm going to cut it. And you can see this is the notch here which is on the left side, killing haptic. There is a notch here on the trailing haptic. So this is kind of orientation. You will see two holes here. This is central hole. There are two holes which are covered by the upper eyelid. So this is the toughing of the lens behind the iris. And once you tuck the lens behind the iris, you can remove the viscoelastic and there is a tucking of the lens behind the iris. Make sure that you tuck all the pixels. You can see the lens went behind the iris, and this is the smart toric lens. You can see mark here and marks here, and this is aligned with the 0-180 degrees. So this is the smart toric technology. Go inside the eye with the irrigation hanky, and then I just go lift the lens little bit, and this lifting of the lens is helpful to remove the viscoelastic, to wash the viscoelastic. So I just go inside. I stay here at the central holes so that the viscoelastic is out, and yes, so you can see I am pulling behind the lens just on the tip and then lifting a little bit without touching the crystalline lens. This is very important. You should be careful not to touch crystalline lens, and then viscoelastic is out. That eye is clean with no viscoelastic there, and now they're going to put some irrigation in the side port to make sure there is no viscoelastic is restored. They know the restore viscoelastic, and we are ready for polypropylene injection and to achieve the pupil wires. This is the ventilation of the side port and second the color intracameral polycarbonate, and the region for injection is, and you can see the pupillary multiply is coming down. Achieve the premises so that the lens haptic and optic pair are behind the common aberration. Try and long just to minimize the inflammation. And this is the injection of intracameral moxifloxacin. So friends, you have seen the successful implantation of Toric Implantable Phakic Contact Lens as to correct myopia or minus 10.5 diopter with 2 diopter of corneal astigmatic. Toric Phakic Lens remains one of the most exciting tool to correct high myopia of minus 10 diopter, minus 40 diopter, minus 30 diopter. You can correct the Toric Phakic Lens technically. You can address the astigmatic up to minus 10 diopter. So this technology is one of the most exciting technology to correct high myopia with high astigmatic in cases where it is not possible to correct using the refractive layer surgery or other surgery. So this is one of the most exciting development in the field of ophthalmology. And with the availability of Toric Phakic lens manufactured from the Indian manufacturer such as Cable India, Appa Swimming and Biotech, BM Care, now we ophthalmologists have the tools and technology to help the patient who want to get rid of glasses and who want to achieve freedom from glasses and who want to live happy and productive life without the use of glasses. So I want to congratulate Akshita ji, congratulations for your successful surgery. Congratulations.